Hi guys, it's Darlene, and today we're going to be talking about illnesses in April. Some of the common illnesses that you will see in April are pink eye, or also known as conjunctivitis, asthma, Lyme disease, respiratory illness, rhinovirus, gastroenteritis, also known as neurovirus. Pink eye, or conjunctivitis, some of the symptoms that you may feel are itching, tearing, stinging, or irritation of the eyes. Conjunctivitis also seems to thrive in the spring, but can often be confused with allergy symptoms. Conjunctivitis can be bacterial, viral, or even allergic in etiology. The bacterial and viral forms are both highly contagious. Also known as pink eye, conjunctivitis is most common among children and is easily spread. Preventive measures include regular and frequent hand washing and avoid touching the eyes. Also, this does not mean that it cannot happen in older adults. While treatment for viral conjunctivitis is for symptoms only, bacterial conjunctivitis will require antibiotics. Treatments for allergic conjunctivitis may include oral and/or ocular antihistamines. There is also respiratory virus, and some of the symptoms that you would feel are sore throat, cough, fever, runny nose. The affected areas are the nose, mouth, throat, and lungs. Asthma is also seen in the spring. Wheezing, coughing, shortness of breath are some of the symptoms, and the areas affected are the lungs and chest. And asthma needs to be controlled because if not, it can lead to other respiratory issues such as bronchitis and pneumonia. Asthma triggers abound outdoors in the spring and can include pollen, air temperature changes, fertilizers, and insect repellents. Indoor triggers such as dust, mold, and cleaning chemicals can also be problematic. Be sure to use your peak flow meters and rescue inhalers if needed, and keep them readily available. Rhinovirus is basically caused by the common cold and it spreads easily. However, it can be very dangerous. Spring is a peak time for common cold. Rhinoviruses, which cause roughly 50% of all common colds, as previously stated, is prevalent during this time. So it is important to wash your hands regularly and avoid touching the eyes, nose, and mouth. Of course, seasonal allergies are also very common in the springtime. Some of the symptoms that you will feel are sneezing, you will have congestion, runny nose, and itchy eyes. The affected body parts are the nose, throat, sinus, and your eyes. Spring is a lovely time of budding trees, bushes, and flowers, but the pollen needed for this to happen is exactly what causes seasonal allergies to strike. In fact, in some states, spring allergies may begin as early as February. Further spring showers may promote mold growth, both indoors and outdoors. Although not all mold species cause allergies, the most culprits include Alternaria, Aspergillus, Cladosporium, and Penicillium. It is important to be proactive in combating your seasonal allergies in the spring. An ounce of prevention with allergies is worth a pound of sneezing and wheezing. Begin with allergy medications about 2 weeks before symptoms are expected. Also, follow the pollen count online so that you know what to do. These are usually available through local weather forecast. Lyme disease is also prevalent if you're out in the woods hiking, and some of the symptoms that you will feel are fever, rash, headache, body pain, and tiredness. The areas affected are the muscles, skin, and head. Warmer, rainy spring weather is the preferred preference of deer ticks, which transmit Lyme disease. These tiny creatures become active in temperatures above 35. Fahrenheit. Avoid strategies work best. So it is important to avoid walking in tall vegetation and to use tick repellent whenever you're staying outside for longer periods of time. Be very vigilant for signs of Lyme disease, including bull's eye rash. Antibiotics of early Lyme disease is usually successful and most commonly includes doxycycline, amoxicillin, or cefuroxime for a duration of up to 21 days. Patients with cardiac or neurological symptoms may require IV antibiotics such as ceftriaxone or penicillin. And last but not least, we have gastroenteritis, also known as the norovirus. Some of the symptoms may include a low-grade fever, chills, headache, muscle aches, and fatigue. And there's really no treatment, just to let the virus run its course. Like rhinovirus, norovirus thrives in warmer weather. They are very contagious, and although the symptoms, which include stomach pain, cramping, nausea, diarrhea, and vomiting, usually last for about 1 to 2 days, those afflicted are usually contagious for 3 days after symptoms abate. Symptoms may also include, like stated before, low-grade fever, chills, headache, muscle aches, and fatigue. Treatment is symptomatic, meaning you basically cannot do anything, just let it run its course. It is important to wash your hands often, disinfect bedding and household items, stay at home if necessary. Thank you for listening to this video where we discussed illnesses in April. Remember to share and like our video as it helps with funding. Thank you so much.